In today's session, we'll explore a topic that is rapidly gaining importance across the healthcare and technology landscape: the regulation and compliance of artificial intelligence in healthcare. As AI continues to influence everything from diagnostics and patient engagement to hospital operations and research, the question arises: how do we ensure these systems are not only effective, but also ethical, safe, and legally sound? Healthcare is a highly regulated field for a good reason. It deals with human lives, sensitive personal data, and high-stakes decisions. When we introduce AI into this ecosystem, we must be especially vigilant to uphold standards of privacy, accountability, and transparency. That's where regulation and compliance come in. Let's begin by looking at the current landscape of regulation. In the United States, the Health Insurance Portability and Accountability Act, or HIPAA, governs how health information is stored, shared, and protected. Any AI application that accesses or uses protected health information must comply with HIPAA rules to ensure data confidentiality and integrity. In Europe, the General Data Protection Regulation, or GDPR, offers robust protections for personal data. It places strict requirements on how AI models handle patient data, emphasizing transparency, consent, and the right to be forgotten. If your healthcare AI tool is used in the EU, or even if it simply handles data from EU citizens, it must meet GDPR standards. But beyond these general data privacy laws, we are now seeing the emergence of AI-specific regulatory frameworks. One of the most significant developments is the European Union's proposed AI Act. This legislation classifies AI systems based on the level of risk they pose. Applications used in critical sectors like healthcare are considered high risk and are subject to more rigorous requirements. These include detailed documentation, risk management systems, human oversight, and post-market monitoring. Globally, we're also seeing guidance from major organizations like the World Health Organization. WHO's framework for ethical AI use in health promotes principles such as inclusiveness, accountability, explainability, and sustainability. Countries like the UK, Canada, and Singapore have also released their own guidelines, and many others are developing national AI strategies that include healthcare-specific provisions. But while regulation provides a foundation, the path to compliance is not always straightforward. Developers and healthcare institutions face several challenges. First, the regulatory environment is still evolving. Requirements may vary across jurisdictions, and laws can change as new technologies emerge. Staying compliant requires agility and constant awareness. Second, managing data across borders adds complexity. For example, an AI model trained in the US may not meet data localization laws in another country. Legal teams, developers, and compliance officers must collaborate to ensure international use of AI tools adheres to local standards. Third, building compliant systems demands strong internal processes. AI developers must document how data is collected, how the model is trained, how risks are assessed, and how bias is addressed. Every model decision, output, and update needs to be traceable. This level of transparency not only satisfies regulators, it builds user confidence. The concept of privacy by design is also becoming essential. This means embedding privacy considerations into the core of your product development process rather than treating them as an afterthought. Features like data minimization, encryption, and role-based access should be part of every AI deployment. Clinical validation is another critical component. An AI tool used to make medical decisions must be tested in real-world scenarios with diverse patient populations. The results of these validations must be recorded, analyzed, and submitted to the appropriate regulatory bodies, such as the FDA in the US, which now has pathways for approving AI-enabled medical devices. Let's take the case of SafeHealth Diagnostics, a company that successfully developed an AI solution to assist radiologists with image analysis. They achieved FDA clearance by conducting thorough validation studies, documenting their model performance, and implementing explainability tools to show how decisions were made. They also ensured the system complied with HIPAA and GDPR, creating a product that was both powerful and trustworthy. Responsible AI governance extends beyond meeting legal checkboxes. It involves ethics committees, user education, patient feedback, and clear channels for reporting concerns. Institutions need to have policies and teams in place to review AI decisions and intervene when needed. Human-in-the-loop design, where AI supports rather than replaces human judgment, is a key safeguard. In closing, regulation and compliance are not obstacles to innovation. They are enablers. They create the guardrails that protect patients, ensure fairness, and support the long-term adoption of AI in healthcare. As AI developers, clinicians, and health leaders, it is our responsibility to embrace these principles, adapt to the evolving legal landscape, and prioritize safety and transparency in every solution we create. By doing so, we don't just comply with the law. We build systems that people trust, systems that truly serve the needs of patients and the promise of ethical modern healthcare.